Hi everybody, thanks for joining me. Dr. Ben Shamoiel here today, and today our topic is sciatica. Wow, one of the most difficult things to deal with as far as pain goes and low back pain goes, sciatica. Today we're going to discuss what is sciatica, how to differentiate sciatica, and a couple quick tips to get some relief from sciatica. Man, who doesn't want sciatica relief? It could really suck, and not only suck, it could suck the energy out of your life. So let's quickly talk about sciatica. The sciatic nerve is comprised of several levels of the nerves that come off your spine. Okay, I'm going to use my spine right here. So a sciatic nerve is made usually from L4, L5, S1, and S2, and all of these nerves come together to make a nice big, I don't know if you can see it over there, nice big thick nerve that goes down into your posterior part of your leg, the back side of your leg, goes all the way down to the calf and right into the feet and under your feet there too. So a lot of people, when they get a sciatic nerve issue, or they get sciatica, it has multiple types of aggravations. Some people will feel the pain sometimes just in their foot. Some people will feel it in their calves. Some people will feel it in the back of their thigh, hamstrings. Some people just in the glutes, and some people will feel it all going down. Now, most of the time we're dealing with one-sided, unilateral, either right or left-sided sciatica. Some people have bilateral. We know that is just worse, and that's where our spinal decompression machine comes in, because we know we're dealing with the central nerve issue here. Now, depending on where the pain is depending on what level the nerve is coming out of. Now, what happens? Now, usually sciatica is very rare that it's an initial trauma. Okay, so that means you might feel like you lifted something and then the pain started, but it's been brewing, right? You might have been lifting for years. I had a gentleman, I'm in a big corporate area, I had a gentleman from across the street bend over to pick up a pen and could not straighten up, and they actually had coworkers bring him in his office chair down through the whole way across the street up into my office because he couldn't move. He was in an office chair. We got him on the table and gave him some relief. But what happens is old injuries such as fall or sports, soccer when you were a kid, or high school or middle school, a motor vehicle accident that never was addressed right, these injuries that we have really young in life can go undetected, real quiet for years, and then suddenly you're going to pick up a paper clip and you can't get up, or you pick up a bag, or possibly something heavy, or even groceries from the cart into the car can start the sciatica. Now, sciatic pain sometimes starts out really quiet and starts to either start from the glutes, the buttock area, and works its way down as it gets worse, and sometimes it starts from the feet and comes up. We're going to take a look at certain things that can cause it. When we're looking at the vertebra here, you can see this is what normal disc looks like, degenerative, bulging disc right here, herniated disc right there, thinning of the disc. All of these symptoms can cause sciatica. So when we look at the spine, you can't just rush to conclusion and say, hey, this is the treatment that's going to work for you. We need to know exactly what we're dealing with when we're dealing with sciatic nerve. Now, there's another one. It's called the piriformis muscle. I don't have that picture up, but I'm going to make sure we pop that up on the screen. It's the piriformis muscle, and about 20% that I've experienced in my practice are piriformis problems, where the sciatic nerve actually goes through the piriformis muscle, and due to a pelvis rotation where this pelvis area might come out of alignment and the piriformis muscle goes across from here, Once this pelvis goes out of alignment, that piriformis muscle now starts to strain and cause havoc on that sciatica nerve, and now we have another form. So we can have herniations, we can have degeneration, we can have piriformis, right? And all of these things will give you the same symptoms, but require different approach to correcting each and every single one. That's why in our office we do several different things. Not only do we look at if you have MRI findings, that's key. We also take motion x-rays in my office to see where the issue is coming from. So that's one of the things we do here that not most other offices do not do. So let's take a closer look at what. So these are discs, bone, disc. This is somewhat of a disc bulge here. I'm gonna make sure you guys can see that. You can see that little bulge pushing through, and this is where our spinal decompression comes in to open up some space to get this to go back into its spot, relieve the pressure. Sometimes it can show like that. You see that red coming off onto the side right there? That red on the side right there is exactly putting pressure on the nerve, and that could go down your leg, causing a whole lot of misery, whole lot of hot pain. And a lot of people will go and they'll get injections. Might buy you time, might give you a little relief. They'll go in there and they'll get surgery done and have this dissected, they'll have this removed, but they really didn't fix the problem. So you can bet within 5 to 10 years, that surgical thing that they did to relieve this is going to come back and start showing up in a different way, in a different problem. So when we look at the spine again, we're looking at all of these types of issues. We have to take into consideration old history of what happened. How did the patient kind of accrue this? We know that, sometimes again, yes, I lifted heavy or I moved the box improperly, but a paper clip, a pen, lifting up their purse, there had to be something that was never taken care of. Old injury, it could have been a slip on ice, it could have been, again, lifting and doing things really heavy. I got some 18, 19-year-olds working for UPS or these lifting big heavy boxes. They don't really think about it when they're that young. Now they're in their 30s and they're dealing with the sciatic nerve. So the reason why we get great results is a couple of reasons. First, we use chiropractic care to make sure that the spinal joints are moving and healthy and making sure that the pressure comes off. We have our non-surgical spinal decompression, where it takes the axial load and pulls the spine apart to allow this to go back into place and open up some space so the patient gets relief. One of the best things that we've had in our office. And third, we use cold laser in here, which could penetrate to reduce inflammation and start repair even faster. So these are our approaches. Now, what can you do at home when you're suffering from sciatica? Let's say, I know at some points, even the over-the-counters will not give you any relief. You might go and you might get some Flexerol or muscle relaxers. They're not really taking care of the problem. They're just going to buy time until you really fix what's happening here in the spine. So a couple of things you can do at home to get some relief. For some people, the plain thing is icing the area, keeping your feet elevated, putting some pillows when if you can lie on your back, is get onto your back, get some ice, elevate your feet, and get some of that inflammation and swelling to go down, especially if it's a very acute, very high pain level. This would help. I also recommend not sleeping on really soft beds, or if you have a pillow top or foamy top where it sinks in, there's no support for your back. Probably one of the reasons you have sciatic pain. So that's why people tend to move onto the floor, because it's firmer and it's more stiff, giving you more support and reducing the pain. So remember that, it's another point. So if your mattress is causing it, you want to take a look at that. Hot showers work in the morning just to get that area loosened up, followed by ice packs. So again, a lot of people can't even get out of bed to get to the office, so these tips are for them. Later on, when it's milder and after patients have received the care, we do have people get inversion tables. Now, I wouldn't put this under a full inversion upside down, but I would do a 45-degree angle to help decompress that area. So those are a few tips that could help you make it through the night. Whether you're in Los Angeles, that's where I practice, Century City, right here in Los Angeles, wherever you are around the world, best thing to do is find a good chiropractor that does take x-rays. Now, there's a lot of chiropractors out there, there's a lot of dentists out there, a lot of MDs. We got great ones, and we got some people who are questionable. Every profession has that, so don't just see because you went to one, that's how all of them are. Find somebody who takes x-rays and looks at MRIs, does a really good thorough history, does their diagnosis right, does their testing right, to see how they can help you figure out exactly what problem you're having and then treat that accordingly. I hope this video was helpful. Those are just a few tips. Again, really good correction comes in the office right here. We'd love to help you. Our information is below. You can check that out. If you have any other questions or comments, go ahead and comment below and I'll try to get back to you as fast as I can. Thanks for joining me, Dr. Ben.